5 NCLEX questions of the day. The nurse is caring for a client who had a seizure 10 minutes ago. The client is now confused and reports a headache. Which of the following phases of seizure activity should the nurse recognize the client is experiencing? A. Ictal phase. B. Oral phase. C. Postictal phase. D. Prodromal phase. The correct answer is C. Postictal phase. There are 4 phases in seizure activities. The prodromal phase is the period with warning signs that precedes the seizure. The oral phase is the period before the seizure when the client may experience visual or other sensory changes. Not all clients experience or can recognize a prodromal or oral phase. The ictal phase is the period of active seizure activity. During the postictal phase, the client may experience confusion while recovering from the seizure. The client may also experience a headache. A client with a T4 spinal cord injury has a severe throbbing headache and appears flushed and diaphoretic. Which priority interventions should the nurse perform? Select all that apply. A. Administer an analgesic as needed. B. Determine if there is bladder distension. C. Measure the client's blood pressure. D. Place the client in the SIMS position. E. Remove constrictive clothing. The correct answers are B, C, and E. Clients with a high spinal cord injury, such as injury at T6 or above, are at risk for automatic dysreflexia or automatic hyperreflexia. It is a life-threatening condition that requires immediate intervention to prevent complications. Classic signs and symptoms include severe hypertension, throbbing headache, diaphoresis, bradycardia, flushing, and piloerection. The most common cause of automatic dysreflexia is bladder distension. Bowel impaction can also be a cause. Tight clothing should be removed to decrease skin stimulation, and raising the head of the bed above 45 degrees or high Fowler's can help lower the high blood pressure. The SIMS position is flat and side-lying. The nurse is caring for assigned clients. The nurse should first assess the client with A seizure disorder who is reporting nausea and an unsteady gait after receiving a dose of phenytoin. B. Spinal cord injury at L3 who is reporting lower abdominal pain and difficulty urinating. C. Malignant brain tumor who is reporting a headache and blurred vision. D. Closed head injury who is reporting drowsiness and vomiting. The correct answer is D. Closed head injury who is reporting drowsiness and vomiting, which can indicate increased intracranial pressure or ICP. Increased ICP is a life-threatening condition that decreases cerebral blood flow. Manifestations include an altered level of consciousness and vomiting. Increased ICP must be treated promptly to maintain brain perfusion and minimize brain damage. A client presents with sudden onset of right-sided facial drooping, difficulty speaking, and weakness in the right arm and leg. The nurse suspects a stroke. Which of the following assessments is most critical to perform immediately? A. Blood glucose level. B. Pupillary reaction to light. C. Deep tendon reflexes. D. Time of symptom onset. The correct answer is D. Determining the time of symptom onset is critical for stroke management, as it guides the potential use of thrombolytic therapy, which must be administered within a specific time frame. Although other assessments are relevant, establishing the timeline of symptoms and activate code stroke or call 911 are the priority in acute stroke care. This is a drag-and-drop question. Match each neurological disorder with its corresponding hallmark symptoms. Here are the neurological disorders. A. Myasthenia gravis. B. Multiple sclerosis. C. Parkinson's disease. D. Guillain-Barré syndrome. Options for hallmark symptoms include ascending paralysis, resting tremors, muscle weakness that improves with rest, and diplopia and sensory disturbances. Myasthenia gravis is characterized by muscle weakness that worsens with activity and improves with rest. Multiple sclerosis often presents with diplopia and sensory changes. Parkinson's disease features resting tremors as a hallmark symptom. Guillain-Barré syndrome presents with ascending paralysis, starting in the legs and moving upward.